This is your co-host, Kurt Wilhelm, joined by
Dr. Lee here.
here on Ageless Living. We welcome you back to our show and thank all of our listeners for tuning in. If you are a person who wants to be healthy, beautiful, handsome, balanced, fit, or fashionable, then you should be tuning into our show. So we also have sponsors who fit those categories as well. And our major sponsor is Arizona Laser and Skin. You can go to their website at azmdlaser.com, or you can make a phone call. What's the best call-in number?
The number will be 480-598-9733. You can call us for a free consultation for any of the health conditions or skin conditions or beauty conditions that you have in mind.
Absolutely, and probably the best testimonial anybody could ever give would be myself. You can't tell, but I'm 100 years old. I'm kidding. But it changed my life literally when I went into Arizona Laser and Skin. For the first time, it didn't just change my life because all of a sudden, wham, I became handsome. Because some of you might debate that I never got there in the first place. However, I am able to become the best person I can. But the reason it changed my life is that I was able to create a firm, long-term friend with Dr. Lee. And there, in that consultation, our first consultation where I came in and made my list of demands, if you've listened to any of the previous segments, you may kind of giggle, as Dr. Lee I'm sure did inside when I gave my list of what I would like to do to myself when I walked in, not realizing that there's so many different options out there that are natural alternatives to before you get into surgery. Now, surgery is a viable option. At the right point, surgery is the right option, and we're going to be talking about that on the show. But a lot of people ask me, what's unique about Arizona Laser and Skin? And what is unique is that if you sit down and say, I want the most expensive, I want the very best, and I want to pay lots of money, they'll take you through all the different options before they take you to surgery. And so then that way you know that when you're spending your money, you're actually spending it in the best way possible. And they've done some things that have really been amazing, where literally I probably in some areas that I thought that I would need surgery, I don't. Including just being able to stimulate collagen growth, things of that nature. But the other thing that it changed my life regarding is balancing my life. I was an extremely busy person. I still am an extremely busy person. But I was able to learn a lot about balancing my life and becoming very healthy. And a part of whether you want to be handsome or beautiful across all cultures, across all different parts of the world, the thing about beauty that remains common, even though there's different strategies to becoming beautiful or attractive to the opposite sex, the thing that remains common is being healthy. And that's what you're going to find at Arizona Laser and Skin. But once you've gone through all of those strategies and it becomes time for you that both Dr. Lee or Dr. Robledo, who's joining us on the show today, have determined, you know what, I think the best strategy is to have surgery. We are honored actually to have Dr. Robledo in the studio with us today, and he is the person who most likely would be doing the surgery on you. So Dr. Robledo, welcome to the show.
Thank you very much for inviting me. I really appreciate it.
You're so welcome.
Now, Dr. Robledo has had a wealth of knowledge base and also a lot of experiences in cosmetic surgery field. Dr. Robledo has done over 1,000 of facelifts.
Correct.
And,
go in, and I challenge you to go into whoever you were thinking of going to before and ask how many they've done. I don't think they're going to come close. So we're lucky to have Dr. Robledo with us.
Well, thank you again for inviting me. The good thing that we try to focus on, or is the best that we try to do, we evaluate the patient as a whole. We determine what the concerns are, and we will sit down with the patient and we will outline what we can do to help correct those concerns. Now, they may involve surgical, some may involve non-surgical alternatives, but we do evaluate the patient completely. We give them all the options, and we try to make our recommendations that would best fit the unique situation of the patient. Surgery in our office is done in a very safe manner. It's always tailored to the patient and to what the needs are. And it's done in such a nice, comfortable setting, thanks also to my associate, Dr. Lee, my partner. She is a board-certified anesthesiologist, so pain is not an issue when we do our surgeries. And we always advise the patient on any other alternative, and many times their concerns can be addressed with non-surgical devices or treatments, and we prefer, whenever we're able to do non-surgical treatments.
You bet.
Can I ask you a few questions, Dr. Robledo?
Sure.
So, say we're going to talk about facelift surgery. How long does the surgery usually take? And is it something, is this a permanent or classic facelift, or is this something called facelift?
That's a good question. Facelifts have come a long way. Many years ago, we only had the traditional facelift, which was a deep dissection and a very involved procedure that required general anesthesia and many weeks of recovery. There were a lot of increased risk with that kind of surgery. It has evolved to the point where nowadays we can do modifications of those initial facelifts, and that's what we call them, modified facelifts now. And they usually combine a face neck lift. And now they are to the point where we can do them very safe and comfortable in an office setting, under local anesthesia, supplemented with some sedation, IV or oral. And the results are just as good, if not better, than the old traditional facelift.
There's some improvement in techniques.
Yes, techniques have improved quite a bit, and we have a lot more gadgets, so you can say, or a lot more little things that we can, technology has evolved, so we have a lot more little things at our disposal that we can do at the time of the surgery to improve those results.
Kind of just to share progress in surgery in general. I had a hernia operation when I was 2. I had one when I was 14. I had one when I was 21. And the surgeon when I was 21, if you think about that, that's about 19 years of advancement in surgery. And he said, you know what, this will be the last surgery you have for your poor stomach, and he put in mesh so that I didn't have to worry about it. And here I am, all these years later. I've never had a problem with hernia operations. It was a congenital thing. It was my grandfather, great grandfather, and grandfather had all had hernias. So it was something that was passed on down. But the point is that similar technology, not so much mesh, but there's certain gadgets, as you call them, that can be placed in the face to be able to lift certain parts of your face, rather than give you that windblown look. So that we all kind of know about the Joan Rivers frozen and pulled back look, where she's constantly in at least 120 degree wind, or mile per hour wind is the term I'm looking for. So you're not going to have that look like you used to have in the old days.
That's correct. Nowadays the procedure has evolved to the point where we can provide the patient with a very natural look, not a windswept look, and using everything at our disposal, the new technology, we can really obtain some very nice results. Patients in general will be very happy and pleased with the results, and occasionally we may be able to obtain results even beyond their expectations, which is even better.
Absolutely. In case you're wondering, I haven't had any of that done. They've treated me very naturally, but at some point, when it's needed, they'll make that recommendation, and when that day comes, it may come.